My goal is to be of assistance, whether it's education, just a big hug, you know, so that they're not so afraid, but to let them know that there's lots of support on this journey. So that's a big lot of what I do. Also do some fundraising, which helps make us have a resource available to help women if they're in the midst of treatment and really starting to struggle financially.
That's wonderful. So if someone was diagnosed with breast cancer, what would be, you know, some things that you would suggest to them for resources here at Hurley?
Well, you know what, if they're coming through the Hurley Health System, the physicians try to get their paperwork to me immediately so that I can initiate phone calls to start giving information and support, answering questions. But a great website women can go to is breast360.org. It's a trustworthy website where they can go and start learning about what their diagnosis means. We have fabulous support groups that meet the first and third Tuesday of every month out at Genesis Hurley Cancer Center. Myself, along with a social worker and one of the other navigators from Genesis, we all co-facilitate that group. So we help women make decisions, what kind of treatments they're having, help them understand how to manage side effects. So certainly tapping into our support groups. We have quality of life programs if they're feeling really stressed. But making a phone call to myself, you know, at least I can start getting them on that path and start answering questions. So they can, you know, ask their doctor for my number, or they can go on our website and my number's available, or they can call me at 262-7207 so that I can help offer some support.
Well, that's wonderful. Now, for some women that are facing with a friend or a loved one that has breast cancer, what are some things people can do to help?
You know, I think going to appointments with their loved ones so they can be a second pair of ears. I think when people hear, I know women, when they hear, or men that get diagnosed with breast cancer, you hear the word cancer, a veil drops, and sometimes that's all you hear. So then your next point of reference is whoever you've experienced it with. If you have a loved one who's gone through breast cancer, you immediately step in their shoes and their story. So that starts to become what you think is going to happen to you, and every situation is completely different. If it's someone who was diagnosed years ago, we have new treatments, we have all different types of resources that maybe someone didn't have access to. So I think the important thing to remember is that your story is your story, and we have to take it one step at a time and help make sure that you understand what type of cancer you have, what types of treatments are available, and then help walk you along that. So a loved one can come along and help be an extra pair of ears, help explain and reiterate what they heard so that they can help bring this stress level down. I think that's really helpful.
That makes sense. That makes sense. On average, how many patients do you see coming through with breast cancer here at Hurley?
Just here at Hurley, we probably get anywhere from 10 to 15 a month, brand new cases. That doesn't include recurrences or but that's roughly what we see as brand new patients, about 10 to 15. That's just here. Then you have to think about Genesis, McLaren, all the other resources. So in Flint, there is a significant number of patients with breast cancer. So, you know, making sure that women look for their navigator wherever they're at to get the help that they need is super important. Mm-hmm. It is.
Mm-hmm. So if someone wanted to help support some of the fundraising or efforts that you're doing, what are some things that general public can do to help?
Well, we do have our great big Pink Palooza, which is October 5th. But we have some pop-up events prior to that night. And back to the Pink Palooza, October 5th is the big Pink Night that's connected with Financial Plus, where we do our great big huge fundraising. But prior to that time, on August 21st, there is a pop-up event at the Serendipity Salon. They can call, get mini manis and petties for $15 each, and I'm going to pull this flyer up if you don't mind. Yeah, they can make appointments, they could do walk-ins, but the money that some of the proceeds go towards the navigation fund, and the money that we raise from the navigation or for the navigation fund is used for patients. We use that money to help support them on their journey. Mm-hmm. if they're in need of assistance. Another event, there's Painting with a Twist, and there'll be a website that you'll be able to go to. Painting with a Twist is September 14th from 7 to 9 p.m. They're going to accept about 48 people that'll go, and they'll have a picture that you can paint that evening, bring wine and food, and just help support the cause. So that's another way that if you wanted to come out and do something fun and help the Navigation Fund, we would be very grateful.
Yeah, that's great when you can mix both.
Yeah.
So when you said that it helps raise funds, what are some of the things that you help fund for patients?
So, you know, we see breast cancer in an aging population, but we're also seeing it in younger and younger women. Maybe the woman is a single mom, maybe she's a working woman that helps support her family along with her husband, and the patient might be out of work for a period of time because they're in very aggressive treatment. That can cause tremendous financial hardship or a fixed income for someone who may be older. So what we do is if they're struggling financially, they can fill out a qualifying form, and we can help pay for water bills, utility bills, co-pays, whatever it is that is creating a situation where they may not be able to continue their treatment or complete it, or just to help assist them so that they're not financially in trouble, you know, that they're not making a choice between whether they eat or take meds or pay a water bill. We want patients to be able to, you know, take their treatment and feel comfortable, and then they can get back to work, or they can, you know, they'll see a change once they're completed with treatment. So.
Right, that's wonderful. And just before we started our little Facebook Live, you were telling me about a young girl that was 5. I guess a testimony that you can help at any age.
Right. One of our nurses on 9 East had mentioned that her 5-year-old daughter wanted to make a difference in someone's life, and she had grown her hair, and it was 11.5 inches long, and so she decided that she would have it cut and wanted to donate it to Wigs for Kids or Pantene Hair to help someone else. So really, you know, sometimes we think, well, what can I possibly do? You know, if you knit, you can make knitted knockers. If you have long hair, you can donate hair. If you have lots of different skills, we have volunteers that do a ton of things to help this program. We have women who sew, who knit. All you have to do is call me, and I can give you patterns for lots of different things you can make to help our patients.
That's wonderful. That's wonderful. Well, we appreciate everything that you do, and I hope if you have a chance to attend one of the events that Marsha mentioned, that you make an effort to go out there. She's doing amazing things right here in Flint to help women that are in crisis, and you can be a part of the solution. Later on, we will add links in the comments below for those upcoming events and ways that you can also reach out to Marsha if you're in need. So if you haven't subscribed to our channel, I encourage you to do so now. On YouTube, it's Cup of Kudos, and give us a thumbs up on our Facebook page. So thanks for watching. You have a great day.